with Tripod Thursday. Hope everyone's doing well on this Thursday. We have today Dr. Kim. She's back with us. We had a segment with her over the holidays talking about fertility struggles around that time and what a sensitive time it is. And now she's back in January, and we're talking about naturopathic medicine. Hi, Dr. Kim.
Hi, Melissa. Thanks again for having me here.
Thank you so much for coming on. We just have a couple questions for you today. So the first one would be, what nutrients may help to improve your chances of pregnancy?
Oh, that's a very good question, and lots of great answers to this because it really depends on what someone's personal obstacles to pregnancy are. Like I said, like there's lots of nutrients, lots of products on the market, lots of information about specific nutrients, about how it can benefit this and that for this fertility issue, and it can get really overwhelming. So the best thing that someone can do if they're looking for improving chances of their pregnancy, of achieving pregnancy, is to have the diagnosis spot on. Having the diagnosis and understanding your own unique health history, your own risk factors, those things will narrow down the nutrients, or overall the care that will really benefit that person. For example, two people with fertility challenges that, and they're both diagnosed with, say, endometriosis. They may have a completely different supplementation plan because, one may be experiencing PCOS symptoms or high testosterone or androgen symptoms at the same time. And the other person with endometriosis may be going through or may have a totally different profile. They may have a cancer history or, things that we don't necessarily think about when we're simply looking at information about nutrition online or wherever. So yeah, my answer to that is it really depends on your own personal history and your unique obstacles. And yeah, having the diagnosis will really help to narrow down what nutrients may benefit you.
Thank you for that. The next question is, are supplements the way to go, and which ones would you recommend?
So I guess this would also be an extension. This is a great question for sure, and my answer would be an extension to my response to the previous one. I am a big fan of supplements when they're taken in the right, the right situation, the right circumstance, because again, it really depends on someone's health history, and you don't really want to go blindly with purchasing different supplements without knowing what the problem is to begin with, the problem you're trying to address with supplementation. However, there are certainly some supplements that tend to be favored throughout favored through with any case, really. So an obvious one is consuming prenatal multivitamins or prenatals. Prenatal multivitamins offer a reliable way to access beneficial nutrients during pregnancy. And a comprehensive prenatal would look like, would contain folic therapeutic dosages of folic acid, iron, vitamin B12, calcium, and when consumed every day, that's highly recommended as well. These nutrients are essential in baby's growth and development, and they may help in reducing birth defects, anemias, and other complications. And this is key because sometimes we don't really get to know when we're pregnant until until you start to see signs and symptoms. But it's a little different when you're going through fertility treatments because you'll likely know if you are. But anyway, a prenatal is often, a good starting point for a lot of people who may not have as much information as they have at the moment. And it is something that can be taken before you even get pregnant, or if you are planning to get pregnant within like a 3 to 6 6-month time frame, it is a great way to just get ahead with your pregnancy planning. So there's that. And I know there might be a lot of talk as well with things like antioxidant supplements. There's a whole range of them. I know in fertility clinics, the nutrients that are often talked about are things like coenzyme Q10. Some people are very familiar with inositols and whatnot. But yes, antioxidants gets a really good reputation in fertility care because of how it can positively impact fertility obstacles, right? So it can influence things like ovulation markers or menstrual cycle, restoring healthy menstrual cycles, and particularly because antioxidants can provide that buffer to reducing some of the impacts of chronic stress or inflammation. So it's generally a good thing to incorporate some antioxidants in your regimen, but that would also, again, because of the variety of antioxidants you have, it's really good to have a sense of what your diagnosis is to be able to find the antioxidant supplement that works for you. So in total, it's really going to depend on what your unique health history and obstacles are.
Thank you for that, Dr. Kim. That's good information. Appreciate that.
A lot of information. Thank you.
Yes. So what type of comprehensive health assessment and treatments do you provide with the focus on naturopathic medicine?
Yeah. So as a naturopathic doctor and integrative fertility care provider, I do use a more holistic approach wherein I will take into account someone's unique obstacles, like I said, and risk factors while undergoing fertility challenges. So the assessments would really focus on, so I do some physical exams as well. And again, it will depend on what concerns come up that stand out in that health history intake. I offer lab testing as well that I can run myself or can be complementary to what your medical doctors might run, in with the intention of really knowing what is going on with your case, right? Because we can definitely get some insight on what the pathophysiology of the issue on hand is. And that's more the assessment. And when it comes to treatment, it will largely be derived from what we gather from the assessment. So, if there's an obvious hormonal regulation issue for, say, things like insulin resistance, then the plan would probably focus largely on helping to support that. It would be focused on the objective assessment that we gather, but your treatment plan will be composed of different tools. I often combine a few things so that you don't feel stuck with just one. You don't feel like you have to fixate on one intervention. There's a few ways that we can do to have a profound impact on your obstacles with fertility. So I often start with a lot of foundational stuff like diet and lifestyle modifications that I would aim for it to be realistic and doable for you. So it's something you can actually start with and you can actually do that's not overwhelming, right? And then, of course, like I said, nutritional supplementation is it plays a big role in my practice as well. So having that assessment will give us a more clear understanding of what the diagnosis will likely be. And therefore, that will lead to to finding out what the best supplement would be for your regimen is. And same thing with lab testing will be part of that plan as well. But a few exciting things that I like to offer in your treatment plan as well are fertility acupuncture treatments. They are it's a great adjunct to care. It's something that can help to give you that opportunity to have to have that time to relax, right? So it may be counterintuitive because there are needles involved with acupuncture treatments, but in reality, it can offer a lot of peace, even for a few minutes in your day. So acupuncture is well researched, and given that there's some conflicting evidence about its actual benefits to certain fertility markers, but in general, like it's a big yes for stress relief for sure. So yes, I offer acupuncture as part of the treatments, and I would usually do a combination of these things depending on your comfort level. So these are some of the things that I offer. They're not often limited to that, but yeah, just the basics. So people have a general sense of what to expect.
Perfect. Thank you for that.
Mm-hmm.
So the last question we have is, how do we get in touch with you to book an appointment?
Sure. So the best way to get a hold of me right now is through my website. It's kimabog.com. There is a contact form in a few areas of my website. So, if you fill that out, that will get in my email inbox. So I will respond to you directly. But I'm also reachable via my social media pages. I'm particularly more active on Instagram and Facebook, and slowly starting up my YouTube channel as well. So there are a few ways to reach out to me. But yeah, feel free to use resources on my website as well, and contact me through there too.
Perfect. Well, thank you very much for your time, Dr. Kim. We appreciate it, and we look forward to having another chat with you in March for Nutrition Month.
Yeah, I'm looking forward to that. And thank you for setting this up, Melissa. It was great to speak again and with you nonetheless. And yeah, it was wonderful to just talk about these things. Yeah.
Yes, definitely. A lot of great information.
Mm-hmm.
Thanks very much. Talk to you soon.
Thank you. You too. Take care.
Take care. Bye.